Taoiseach, I want to raise today with you the adverse effect that the coronavirus is having on people with varying other illnesses or health issues in Kerry or indeed all around the country. At present now there are no orthopaedic procedures being carried out in Tralee General Hospital unless emergencies or fractures or something very urgent. Now people are being told that routine procedures will take 4 to 5 years and urgent is 2 years for elective procedures. Sick people can't visit GPs or GPs can't visit them, mostly only on the phone, and this system doesn't help their confidence to recover. Bed reductions in our community hospitals, Killarney to close off 15 beds. Maybe he'd consider opening up the single beds in Kilmare Hospital, a new hospital that doesn't have wards, only single rooms. St Columbanus's public nursing home to close off 27 beds. This is impacting badly on the people in the Killarney catchment area. Patients in hospitals or homes can't have visitors, very hard on elderly people. We should be able to facilitate 1 or 2 family members every 4 or 5 days. I know one family that brought their father home because they couldn't bear the thought of having him not being seen in Tralee General. Elderly, sick people, more likely than not, don't have time on their side. The primary care set for disabled people, children and elderly people who have strokes and different things, to adapt their car or to help them buy a car, a modified vehicle applications are now not being processed. Where are all the billions being given to the HSE? If we double the HSE allocation, I don't believe they would or could deliver a proper service. People in Kerry can't get the flu vaccine. Doctors don't have only a very small amount of vaccines and actually have to decide who need it most. And people are ringing up every day with over a month and they can't get the vaccine. Depression and suicides have increased because of the virus. It's very clear that we in Kerry, even before the virus, don't have adequate facilities to admit patients with mental health issues. Even Dr. Finnery has said patients have repeated admissions because of lack of adequate facilities have to be let out again and brought back in again. She calls it the revolving door of admissions. I know of one person who has been waiting in constant pain since the 1st of March for a pre-op and had a pre-op assessment just on the 12th of August and is still was up again recently at 7 times going to A&E in Cork and is still in constant pain and needs a procedure.
Thank you.
I put just I put down a parliamentary question to the Department of Health, and the reply I got back, it is recognised that waiting times for scheduled appointments and procedures have been impacted as a direct result of the corona payment. That's not good enough.
Thank you, Deputy. Taoiseach, please.
Thanks, Deputy, and the Deputy raised a few important issues there. Just in relation to the flu vaccine, there is very high demand for that at the moment, which is encouraging that people who would not have sought the flu vaccine in previous years are really seeking to be vaccinated this year, and that's a real positive. Supply is short, not just in Ireland but internationally. There is more on the way, and no matter what happens, we will vaccinate many more people against flu this winter than we have in any winter in the past. So that's a really important progress being made there. But we do need to prioritise, and it is those who need it the most who are being prioritised: healthcare workers, older people, and those with chronic conditions, and also children between 2 and 12 using the nasal spray to vaccinate them. In terms of suicide and deliberate self-harm, we had a discussion about the mental health impact of the pandemic and the lockdown at Cabinet Committee on Social Policy there the other day. The evidence that we have, the research that we have so far, doesn't show any increase in suicide or in deliberate self-harm during the pandemic period. So please God that will continue to be the case and will continue to be true. But it is certainly the case that the pandemic and the lockdown is having an impact on people's mental health, and we are seeing an increase in calls and inquiries with mental health services, and resources are being increased precisely because of that. On waiting lists, I totally appreciate what you're saying, and I know there are far too many people waiting far too long in Ireland for the operation that they need or the appointment that they need. The health budget for 2021 is 4 billion higher than this year. It's an extraordinary increase in the budget. 10 times the kind of increases that we might have seen in the past. And 2 billion of that is for COVID and 2 billion is for non-COVID. And hopefully that will allow us to make real inroads into those waiting lists in 2021.
Just this morning when you spoke about health service workers, a young fella, he told me that since February he's lame, and he was told today that he will have to wait 3 years before he's seen. What I want to know, Taoiseach, is, and the people of Kerry and Ireland want to know, who's responsible for telling or giving the order to specialists and consultants in the hospitals to cancel or defer appointments and to defer elective procedures? What are the people, these specialists, going to be doing in the meantime? Is it the government? Is it the Minister for Health? Is it Neffet or Tony Holohan? Because people can die from other illnesses or diseases as well. And just because the coronavirus arrived doesn't mean that they're going to not get other illnesses or suffer and great pain and indeed die from other illnesses.
All right, thank you.
You have to recognise that.
Thank you, Deputy.
And Tony Holohan has to recognise that.
Right, thank you. Taoiseach.
We do recognise that, Deputy, and I know the Chief Medical Officer recognises that too. One of the real concerns that we have during the pandemic is what people call secondary deaths. People who have a heart attack, for example, not going to the hospital because they think it's overwhelmed and they don't want to bother the doctors and nurses. People who have stroke symptoms, perhaps delaying seeking medical help because of the pandemic. And that's a real worry that we have, and that's why we're sending out the message to everyone who needs medical attention to seek it. We have 800 more beds, 400 acute, 400 subacute than we had back in March, and many fewer than that number of patients in hospital with COVID. If you look at the level of overcrowding, the number of trolleys, people on trolleys in our hospitals, it hasn't been lower since records began. So we have capacity, and we are saying to people that if they need medical help, that they should. On occasion, hospitals do have to cancel operations. There may be very different reasons in different cases why that is. It could be because of a lack of beds, but it could also be for other reasons too.
Thank you very much.